Hi, everyone. I wanted to talk to my female clients about whether they should consider um, whether couple therapy is would be a good thing for them. There are some ways in which couple therapy can be very helpful. Um, if there's been an affair, I think there's some really skilled couple therapists out there. I really like the emotion focused couples therapists, and I think if there is a parenting issue, getting parenting help together as a couple is very important. Um, I think like also just navigating changes in life, an illness, adjusting to having children, sort of a glitch in the system where you have a relationship that's really a solid relationship that's felt very mutual and reciprocal and healthy, and you're now kind of in a difficult patch. You're going through a rough patch. You use a little help. However, there's some newer research around couples therapy that it really has a patriarchal bent to it, and the couples therapist tends to allow the male, if it's a heterosexual couple, the male in the couple to define the problems and the female in the couple to make the changes. And a lot of couples therapists are not willing to hold men accountable in couples therapy. They do that in a very, very limited way. So if the issue in the relationship is an imbalance in power, so if there is an imbalance with caregiving, with domestic labor, with the cognitive labor, or the emotional labor, which I define according to socio-emotional relationship therapy. So that's, an imbalance in perspective taking, imbalance in attunement, imbalance in openness and vulnerability, or an imbalance in relational responsibility. When that is imbalanced, that's also an imbalance in labor because all of that emotional work is also work. Um, if that's going on and you as a woman are thinking, I'll go into couples therapy and the couples therapist will see my point of view and address the power imbalance, unless it's a cert couples therapist, they're probably not going to do that. In fact, the problem could get worse. Um, if your partner, and you have, a partner who's willing to um, show humility and admit when they're wrong, if they are willing to talk about gender roles, if they're willing to talk about power, um, if that is part of your relationship, then I would recommend starting with the workbook that Dr. Carmenitz and Martin wrote, which is a CERT workbook. And if you are both like really responsible to the relationship and you can set aside time each week to do parts of the workbook together and talk about it, if you have that going on, you're probably a great candidate for doing couples work. If you have a partner who, doesn't really admit that they're wrong, they're very adversarial, they tend to take a dominating stance, they engage in a lot of aggressive posturing or verbal aggression, conversational control. If you have a partner that, is okay with you having, being exhausted and not contributing to the work in the household, if you have a partner who thinks that they don't have a responsibility to see your point of view or to validate you, um, it's really unlikely that there's going to be a big change with couples therapy. You may see incremental change. Quite often what you might see is a reduction in verbal aggression, but not necessarily an increase in the emotional work. So you would have like the worst symptoms of the behavior might improve, but you're not sort of reaching mutuality and reciprocity in the relationship. If that's all you want, if you're just like, I really need his verbal aggression addressed, um, then by all means. But in most instances when there's verbal aggression, it's an act of domination, and that is somebody who is uh, wants power over you in the relationship. So think carefully about entering couples therapy. Don't it's not necessarily going to resolve all the issues that you have. Um, and when there's a power imbalance in a heterosexual couple, it's very, very difficult, and in most cases close to impossible, for the woman to successfully gain ground in that situation without leveraging some major consequences. And that's because our society tells men that they are entitled to receive uh, the lion's share of the emotional labor, the caregiving, the domestic work, all of the behind the scenes uh, cognitive labor that often mothers do, and not reciprocate. And unfortunately, because it's a very self-centered perspective, there's not a lot of insight into that being problematic. And, women will make good attempts to ask for equal treatment in that relationship. And if someone is consistently disregarding, ignoring those requests, they are not interested in an equal relationship. They may be interested in the appearance of an equal relationship among your social group, that might be something that your social group um, prefers and wants that to be the sort of that image needs to be presented. But in reality, that's not what your partner wants. And then you've got to ask yourself, how long do I want to stay in a relationship? And what are my options? And I'll talk about sort of like some other options in a video with Lisa Case a little further down the road. Okay.